Good evening, everyone. Very warm welcome to each one of you. And thank you for joining us today for this free neurotherapy session. And this neurotherapy session is on high BP. And we are so happy to see all of you joining on time, especially. And applaud you for joining on time because time is so important. When all are there during the start of the session, you can understand the session so nicely from the start to the end. And again, when you join in between, the problem arises that you lose so much of information in the starting and you have to wait for the recording later. But when you join early, you can be, taking care of everything from starting to end. You can understand the concept easily. Even if you miss, someone will be asking a query, so everything will be repeated. So, firstly, thank you for joining on time. And actually, all of you might be so far, we had been having so many classes, and this has been there from past 5 years. Only there was a gap in between for neurotherapy. But otherwise, many of you who are regular participants who already know neurotherapy, and some might be practicing too. So I'm so happy that you have joined again for these sessions. And for those people who are new to neurotherapy, let me be clear to you and explain to you that neurotherapy is something, one of the alternative therapies we have in present times, which can help you clear your problems. For example, you might be having multiple problems like indigestion, high BP, diabetes, or many things might be there within yourself which might not be clearing with the daily tablets or daily whatever therapies you take other than your general health life and lifestyle. So in neurotherapy, what happens is whatever you are doing, like whatever sir is teaching you as treatment, when you follow it, one treatment will lead to many other major improvements in your body, because one root cause is cleared, that will only lead you to more and more good health, because many other connected problems might be there, because BP might be due to your high sugar, or indigestion might be due to high sugar only, or high BP might be the main reason for non circulation in your body. So all these things are so much correlated. And when you're starting neurotherapy, when you're doing it sincerely, especially you have to give time. Just like you give time to your food, sleep, and everything, you have to give time to neurotherapy, because it will be working personally on you and you will be working on yourself. Especially you will be understanding what treatment to do, to be able to do on yourself with the combination of therapies sir tell you. So you can have sir's help here through these free sessions. You can ask what particular and proper treatment you can take for this particular individual problems of yours, because the combination might be changing for different people in different ways. It might vary. And sir also answers in the group. So whenever you have a problem and you are confused with the treatment, the simplest thing you can do is go back to the main group, Joshi's Kerala Telegram group, and put at Ramachandran sir or at neurotherapy, and just write down your query, because that query will reach sir. Sir will be able to observe that particular query and answer according to you and your problem. Okay? Because generally in class, whatever suggestions, treatments are given to you, this is for common problems, like not for multiple problems. For example, high BP is only for high BP, and some few only might be correlating with high BP. But when you personally have multiple problems, we request you to particularly consult Ramachandran sir, Acharya Ramachandran sir personally, because he will be providing his information personally in the group. And also, if it is tactable, like if you think the treatment can be managed by yourself without sir's help, by watching all the videos now so far, whatever classes you have gone through, then that will be more helpful for sir, for him to explain to you personally or through groups what you can do, because you have already gone through all the videos, all the classes, all the treatments, so you can understand it easily when he tells you so and so is for your problem. Okay, so attending the classes regularly, managing to make notes, and requesting for this recording in the group is very important for all of you. And now, without wasting much time, let us all welcome with our grateful hearts for this evening's session to Acharyaji Ramachandran sir. Acharyaji, a warm welcome to you from all of us and Joshi's Kerala group for this high BP and solutions topic class. And a warm welcome from all of us. And now the class is yours, sir. Thank you. Please take over. Good evening.
Thank you. Good evening to everybody. Thank you, Anusha madam. And first and foremost, I would like to thank Joshi sir for starting this wonderful therapy group where so many alternative therapies are available for so many people. And I thank each and every one of you personally and collectively for having joined today's class, and also for those many of you whom I know are regular members of my classes. So today we start with blood pressure. Mainly we'll be concentrating on high blood pressure, though some this thing will be there also for low blood pressure, but mainly because most of the people nowadays are suffering from high blood pressure only. So that is what we'll be covering mainly. Okay. And of course, as I always do, probably you must have known, I always give a lot of theory, because unless you are convinced about the scientificness of my knowledge and the therapy, then only you will be tempted to try it out. So we have all seen in the diabetics challenge group, so many people have got benefited because I gave them a lot of theory and also I gave them individual solutions. So like that, today we'll be covering in general some of the important treatments for blood pressure, and which normally brings good results. And I request all of you, if you know anybody who is having blood pressure and they are not yet joined, you can ring them up and ask them to join, because in the beginning stages there will be only a little bit of theory. Maybe many of you may be also familiar with this theory, because I'll be explaining what blood pressure is, what are the practical implications of it, what are the causes, symptoms, and all that. And I'll be giving some examples also so that you can relate it with your day-to-day life. Okay, you can see, you can understand what is happening by this blood pressure and how it is relating to people's lives. Okay, so now we start. So as all of you know, blood pressure is nothing but the force exerted by the circulating blood on the walls of the arteries and vessels, and veins. So it is a crucial indication of what? Of cardiovascular health. That means how well your cardiovascular system is working. That is indicated by the blood pressure. Okay, so normally it is measured in millimeters of mercury. When we say 120 by 80, it means 120 millimeter of mercury and 80 millimeter of mercury. So this is how it is. And it has, as you all know, two values. The upper value is called systolic blood pressure. The lower value is called diastolic blood pressure. Just 1 minute. I will just. Okay. Now, this systolic blood pressure is the pressure during the heartbeat. That means when the heart has got 4 chambers, 2 upper chambers, they are called atria. 2 lower chambers, they are called ventricles. And when they are pumping, at that time, when the lower ventricles are pumping blood, At that time, whatever is the pressure on the blood vessels, that is called systolic blood pressure. And then the heart rests in between meals, in between beats. It rests for a small second, 0.4 seconds, in fact, very small time. But that rest is very, very crucial. And that indicates the diastolic blood pressure. So when the diastolic blood pressure for some people is higher, what it means is that their heart is not resting as well as it should. Okay. And whenever we have a range, 120 by 80 is an average range. And this also changes from age to age, from males and females, etc. Weather also sometimes contributes. So there will be changes. So it's not exactly 120. It is not always exactly 80. It will be varying, but it should vary within a small range. It should not vary erratically. And normally, a difference of approximately 40 millimeters of mercury, that is between systolic and diastolic, is good. But at the same time, this cannot be always the same thing. Suppose you have very low blood pressure, then at that time the gap won't be 40. That means a person who is having normally 120 by 80, okay. Suppose instead of 80, you have 60 as lower blood pressure, diastolic blood pressure. Then 60, the upper should be 100. It may be 95. It may be 90. It may their body may not be able to produce 100. That does not matter. But it will not go from suppose the upper is 100, the lower cannot be 45 or 50. That is too low. So these sort of things, this happens due to the person's constitution. So we are not talking of such extremes. An average 120 by 80. What are the formulas which can be done? And I will show it, demonstrate it here, so that you can see it. And those of you who are having BP, you can do it with me, and you will feel very nice. Okay, so now I will give some statistics also. The Indian Council of Medical Research in Delhi, ICMR, okay, they say that more than 220 million Indians suffer from hypertension. And this is not really a correct figure. He says that a very substantial number is not diagnosed even or inadequately treated. This is what ICMR says. They said it in their study in 2021. So now we are going to see what are the types, causes, symptoms, and diagnostic methods. We'll be teaching you the diagnostic methods also. Various methods are there. So how they do it, all these things. Because once you have this knowledge, you can talk, as many of you are therapists, you can talk very authentically with your patients. So that is why I am giving all this theory knowledge. Okay. And as madam said, anybody who has a particular problem, they can always consult me. They can, my phone number is available in the group, or you can write in the group. You have to mention my name, of course. So if you do like that, then I do attend. Okay. Okay, then. So what are the types of blood pressure disorders? It's a disorder. That means something which is not in order. It is not something which cannot be set right. Disorder is something you can set it right. Your house is in disorder. You can set it right. You can bring it to order. So it is not incurable. Only certain rules and regulations have to be followed, certain methodologies have to be followed, then it can be done. Okay, so I will also tell you some of the common methodologies. What are the ways in which you can prevent yourself from getting blood pressure and all that. Okay, so one is hypertension, that is high blood pressure. Another is hypotension, which is low blood pressure. And hypotension also has got 2 or 3 other subdivisions. Hypertension is divided into what is known as essential hypertension, that is primary hypertension. Then that means it has no identifiable cause why it is happening. Then there is one secondary hypertension, which is got a cause. Normally, it can be due to kidney disease or hormonal disorders. Primary hypertension, no cause. Secondary hypertension, due to kidney disease or hormonal disorders. So most of us have in the beginning only primary hypertension. And it can be set right. We can see it. And we have been helping so many, more thousands and thousands of people. In the past 30 years, we have got almost 5,000 therapists who are working all through India. And almost everybody would have by now cured at least 100 to 200 cases of hypertension. Okay, so why I'm giving you this figure so that you can be really confidently, you can take it up, that if you have a problem, you can approach me. Okay, then, so we have got two types of hypertension. Now, hypotension, it's also known as low blood pressure. So it has got two types also. One is while you are standing, you have a drop in BP. That means when you are sitting, you are more or less all right. But the moment you get up, you stand, you feel some dizziness. That is, you are having low BP while standing. That is called orthostatic hypotension, orthostatic hypotension. And then you have got postprandial. In diabetes, you have got postprandial sugar, PP sugar. Like that, you also have postprandial hypotension, which means as soon as you eat food, then you have a drop in BP. And why that happens is because when you eat, your blood supply should go to the abdomen. But your body is having limited blood supply. The blood volume is less. So then what happens? Some blood goes to the abdomen, then enough blood is not available to the head. And the head also requires a lot of blood. So then you feel dizziness, etc. That is postprandial hypotension. Then there is another type, a third type also, that is called neutrally mediated. So these are all certain, that's a rare case. Okay. And World Health Organization, in their report in 2022.
Are you sharing the PDF, sir?
No, I'm not. This is not PDF. If it was PDF, then I would have shared it. I have made my own notes. Okay. So I'm just World Health Organization in 2022, they said that the main reason for all these hypertension increase, 220 million, they said no, urbanization and lifestyle shift in India. In India, one is urbanization and another lifestyle shift, living fast, erratic lives, etc., not listening to the rules of nature. So all these things are causing this problem. So let us see some examples so that you can relate it with yourself. Say you have a 32-year-old, IT is now a very common, this thing, business, IT business, information technology. So he is a person. We have got cases like that. So I'm just giving you some of our cases. Right, 32-year-old IT worker, Bangalore. He was diagnosed with early hypertension. What is it due to? They said it is due to stress and lack of physical activity. Now, executives don't have much physical activity. So, and in addition, they are having stress. So that causes hypertension. Most of them will be hypertension only. Okay. Then if you are in the village, we had a rural woman in Bihar. She has basically a thyroid disorder. And thyroid disorder causes secondary hypertension. So the first one is primary hypertension due to stress. The second one is secondary hypertension. Then a 60-year-old diabetic from Kerala, he experiences postprandial hypotension. So yeah, hypotension, right? That's right. So postprandial hypotension means, as I said, after eating food, the body is not able to digest that food properly, then he will have postprandial hypotension. And since he was already a diabetic, So it became a bigger problem. Then, of course, we have been treating for both, and then he's got good results. Then we may say that, oh, it is because of age that hypertension or hypotension comes. It is not necessarily like that. If a person is a good yoga teacher, one of our friends is a good yoga teacher in Uttarakhand. So he maintains stable BP in spite of his age. He is now already 65, and he maintains excellent blood pressure. But at the same time, nowadays many people are eating high sodium fast food. Almost all dabba pack items are having extra sodium, extra salt in it. And that salt is not needed for us. You have salt in chips, you have salt in everything. Okay. So I just gave one name. So all that, what is it happening? It is, though he is only a teenager, but he has developed hypertension because of eating this high sodium packed food. And similarly, I went to Bombay some time ago, and one of the taxi drivers, he was talking to me. He says that I am having so much stress because I have to work from morning till night, and I am also having hypertension. So that is stress-induced hypertension, like that. Then you have got doctors are also having hypotension. Yeah, hypertension. Many of them have hypertension. They pop pills. So this also is there. Then once a lady in Navaratri, she's an elderly woman. And this happened in Rajasthan. So she collapsed during Navaratri. Why? Because she was fasting. And when you fast too much, what happens? Your salt, everything is low. So naturally, you will get what? You will get hypotension. So fasting can lead to hypotension. And similarly, if you are a patient with stroke, then you can have uncontrolled hypertension. So now, these are all some of the examples. Okay. Then, what are the causes of these blood pressure irregularities? They say one is, I will go to it in great detail. One is genetic predisposition, then obesity, secondary lifestyle, high salt intake, then chronic stress, alcohol and tobacco use, and conditions such as diabetes and chronic kidney disease. Okay, now hypotension may result from dehydration, nutritional deficiencies, blood loss, or endocrine disorders. So these are these things: dehydration, nutritional deficiencies, blood loss, or endocrine disorders. So you can have diabetics. They can have hypertension due to diabetic nephropathy. You have heard about it, diabetic nephropathy. I spoke about it in my diabetes class also. So then there are communities, the tribal communities, who have high salt diet, and they are, because they work in the sun, no, they require salt. They require salt. But if they are addicted to a high salt diet, then they get elevated BP. Then anemia also can lead to hypotension. Then there are, as I said, yoga gurus. They manage optimal BP with lifestyle practices. We'll tell you what are the lifestyle practices you can do. Then students nowadays are experiencing stress-induced hypertension. And that can be, this thing also. Students and executives, all these people. And if somebody is a smoker, he can have chronically elevated blood pressure. Okay. So these are all some of the things, this thing. Now, let us see what are the common causes and why they cause high blood pressure. Why hypertension is caused due to genetics. Like that, we'll see. So basically, in genetics, what happens? Family history plays a significant role. If one or both parents have high blood pressure, you are more likely to develop it. Why? Because you are living the same lifestyle and following the same practices with your parents are following. So already, first of all, you have a predisposition towards hypertension because of your parents. And since you are following the same lifestyle, then you are likely to get develop hypertension. And then why it is increasing the BP is because the genes, they influence the way your body manages sodium. So because of the genes, your body manages sodium in the same way which caused hypertension to your parents. So that is why it is happening like that. So then it also balancing of the hormones or imbalances in the hormones. All these things are coming to us from our genes. So sometimes some people inherit a tendency of overactive blood vessel constriction. That is, when the blood vessels are constricted, that is what causes this thing, high BP. Otherwise, some people may have a tendency for sodium retention. So sodium retention also means high BP. High BP people are advised not to take so much sodium. So this is why it is so. So we had a case, a 32-year-old chartered accountant from Jaipur. On the externally, he appeared to be the picture of health because he maintained a balanced diet and he avoided smoking, alcohol, etc. He jogged regularly. But then, during a routine health camp at his workplace, the office was conducting routine health camp. He was surprised to learn that his blood pressure was 150 by 95 from 120 by 80, which is norm. 150 by 95 was his blood pressure. Then they asked questions, the doctors, and it found out that his father and grandfather both suffered from hypertension, and they also had heart disease. So despite his healthy lifestyle, because he did not know about it, then his genetic because of genetic predisposition, it had increased. So this shows how heredity can override behavioral factors, even though he was maintaining a very good lifestyle, but heredity changed all that. And then that is why early screening is very much essential and it is very important. Okay. Then we come to obesity and sedentary lifestyle. After genetics, obesity and sedentary lifestyle. So we all know that excess body weight increases the workload in the heart, and that affects the hormone balance. So why does it increase the BP? Because excess weight means most of it is fat. Now, fat tissue, what does it require? More oxygen and nutrients. And this increases the volume of blood circulating through the blood vessels. Sorry. So the more blood flow then increases the pressure on the artery walls because blood is flowing more. And why? Because fats requiring more oxygen, more nutrients. Okay. So then obesity is also associated with another factor that is called insulin resistance. And then the insulin resistance causes increase in the sympathetic nervous activity. And sympathetic nervous system always increases blood pressure. Why? Why does sympathetic nervous system increase blood pressure? Because it is called sympathetic because it sympathizes with the body and it allows the body to prepare itself for fight or flight. Bhidana ya bhagna in Hindi, we say. We can, anybody, you can translate it in your own way. Okay, fight or flight response, it is called. And that is where the sympathetic nervous system, it sympathizes with the body so that the body can take care of the sudden exigency, fight or flight. And for that, it does so many things. It increases this thing of the eyes, it increases the heartbeat, it increases the lung breathing rate, and then at that time it decreases the blood supply to the digestive organs, decreases blood supply to urinary system. Like that, it's a very concerted effort. It is not a one-off this thing. So when that is happening, then it automatically the blood sugar goes up, the blood pressure goes up, automatic. These are all automatic as a result of sympathetic nervous system activity. So that is why these things, and that is where yoga, meditation, all these things play a big role. Okay. So for obesity people also, if The best would be they should do some exercise, dynamic exercise to reduce their weight. But if that is not possible, at least they should do regular pranayama, yoga, etc. Okay. So we have a case from Bangalore itself, a software developer lady. She contacted us. She said she spends most of her day seated at her desk, working late into the night because you have to this thing you have to work on international projects. Bangalore means software means international projects, so you have to work for that. So she had no time for exercise, and she did not know that it's very essential. She had a diet reliant on food delivery apps. So what are they? This thing they only give junk food. Junk food means which the body does not require. So slowly, she increased her. The body weight started increasing. She was unaware of it, and finally, after about 8 to 10 years, she lands up with the 20 kilos extra. This thing over a decade. Then, then she went for a checkup, and then there it was borderline diabetes and hypertension both. Her body mass index was, I think it was 32. Okay, so and then she had a slightly bigger tummy, so that indicated visceral this thing obesity. That is almost I mean big tummy, about I think 38 or 40, 42 like that. So all those things means it is cardiovascular risk. So this is a common common case in India's growing urban workforce, and where high-paying jobs often come with sedentary habits. That is the difficulty. You will see nowadays big top management executives, really the CEOs and other that level, those people who are earning well, they spend a lot of time at the gym and at maintaining their health, because they know that if they become fat, then immediately their body is they are going to have so many problems. So we want that lower, down the line managerial executives, etc., management, these things, personnel, they should take this. They have to give priority to their lives. They need not have so much other entertainment, but priority to exercise and dieting, etc. Proper dieting is very much essential. We'll say what are the dietings we should do. Then high salt intake. Sodium, it causes the body to retain water. So what happens? Sodium and water, they will come together. They will stay together. Urine only has to remove the sodium, and there the sodium goes out through water. And if the sodium is not able to go out, then water will also stay in the blood. That is why the high blood pressure, high blood volume is there. Because urine, sodium, they are taking too much, and that sodium is staying within the body, and the body blood volume is going higher and higher. So that is why in our treatments, you will see we have got something called kidney clear treatment. So this kidney clear treatment is one treatment where you require another person to give treatment. But otherwise, most of our other treatments in today's class, you will see there will be something which you can do on your own. Okay. So why does this high BP increase due to sodium? Because extra water which is pulled, that raises the volume of the blood in the bloodstream, and this increases the pressure against the walls. And what are the ways in which sodium is taken? Either you can have it as pickles, papad, chips, salty snacks. You cannot have a snack without having salt in it, because then it won't be tasty. You cannot eat bland snacks. So all these things, and most of it is in processed food. So they contribute heavily to this issue. So we had a small trader in Varanasi. He had a lifelong habit of consuming heavily salted foods. He cannot live without papad, chips, etc. So then and also achar. In Banaras, they know how to prepare varieties of achar. In Banaras, Gujarat, all these places, varieties of achars they can prepare, even in Tamil Nadu. So then he had all that, and he will eat a lot of achar because he wants something always in his mouth like that. So by doing all that, he will say that I think the food is lacking flavor without this salt addition. I say, his wife used to make good tasty food, but then he will always add extra salt, pickles, etc. But then he had severe headache and then fatigue, and then it was revealed 160 by 100 was his BP. So then actually the doctor will say you have to reduce your salt, and then he adopted a balanced diet, and then he took medications, and then it within 2 months, of course, with neurotherapy treatment also, he showed marked improvement. So this means that dietary habits and culinary habits, your eating habits, they can influence cardiovascular health and blood pressure. So, we should, all of you, I request that please reduce your salt intake by pickles, papad, chips, etc. Keep it to a little minimum. Okay. Then high fat intake and poor diet. So this is the fourth, this thing. Then high fat diet, high fat intake means diets in saturated fats. There are many food items like that in saturated fat. They can lead what is known as arterial plaque, formation of arterial plaque. What is arterial plaque? Artery, within the artery, you have the fatty deposits. That is called arterial fat deposit, and that is called arterial plaque. And what happens when the artery is fully round? Now, in all these places, you have a lining, thin lining of fat deposit. And slowly it increases also sometimes. So then what will happen? The artery, instead of having a diameter, say like this, it becomes slower, it becomes like this. So this means the heart has to pump more. And naturally, whenever a pipe reduces its diameter, the pressure will increase. You all know in garden, when you are having a water hose, suppose if there's a lot of water coming, it is falling just here. But then if you press this thing, that it will go farther away. It's very simple. Same thing happens to us also. When there is plaque formation within the arteries start getting narrow. And so this, and apart from that narrowing, it also makes the artery hard. Now the artery has to move like this every time. Whenever the blood is pumping, it has to expand. Then when the blood pumping is less, it has to come back. But now it becomes hardened. So it cannot pump as efficiently. And that is where the heart has to give great pressure. So this is why this is called vascular resistance. So for example, we had a case, a homemaker from Hyderabad. She frequently indulged in high-fat foods, fried snacks, red meat, creamy desserts, etc. Then her traditional meals were always rich in ghee and oil. So externally, she appeared very plump and healthy. But then she had, when they tested her for something, at that time it so happened that her blood pressure was checked, and she had hypertension with high LDL cholesterol. Now, LDL cholesterol as such is good if it is in very small quantities, it's okay. What should be high is HDL cholesterol, high density lipoprotein, that is called good cholesterol. But she had that LDL cholesterol that is not so good. We can call it bad cholesterol. So then her arteries, Doppler ultrasound was made, then you can see that the arteries are having arterial plaque. So that's all because of the diet. The doctor, of course, told her, he warned her that if you want to live well, then if you want to live healthy, then please, you have to modify your diet. So then like that, it has so happened. And so fried foods and cholesterol, they increase the arterial pressure. Now we come to another very important. So all these are practical. I will tell you what are the treatments which we can give. Is fortunately for neurotherapy, 1 or 2 treatments work for all types. So we'll be teaching you that also. But you should understand, it may not always work like that. There may be changes based on the individual, this thing, understanding. But we'll teach you some treatments for high BP. And as I said, I thank now almost 88 people are here. Thank you very much for joining. You will really enjoy it because I'm going to teach you some treatments, and I'm giving you a lot of information about how you can convince your patients, most of your therapists, how you can convince your patients with solid, factual information. Okay. So stress, as I told you, a chronic stress, it increases the fight or flight response. It happens, and then automatically it increases BP. That is normal. It will increase BP. It will increase sugar. Whenever you have sympathetic nervous system working well, this is not hyper. Even working well, it has to, because when you want to fight or flee, fight or flight, when you want to do, then for both of that, you require very good blood supply. You require more blood supply to the arms and legs. You require blood supply to the eyes. So the eyes will become dilated. And that becomes later a problem, because if you have too much dilation, then when you close your eyes also, you cannot go to sleep easily. That is why people with hypertension suffer from sleep problems. Yeah, because of that, because of the dilation of the eyes. So releasing, what are the hormones which are released? One is called adrenaline. Okay, adrenaline, epinephrine, and another is cortisol. Now these are of course they are good for the body, but at the same time they increase the BP, because adrenaline and cortisol both, they increase heart rate and they constrict the blood vessels. So that is why over a time what will happen, stress can cause long-term activation, and this thus once the BP goes up and cannot come down, it stays at a high level, elevated BP. This is happening to many Indians in urban areas, especially due to work pressure. What are the types of stress? You all know, either work pressure or financial stress, and coupled with that, lack of sleep. First, it starts with their improper sleeping habits, start the hypertension, and later on, due to hypertension, they are unable to sleep. So it's a vicious circle, unwanted vicious circle. So, for example, many youngsters around 29, 30 years of age and all, they aspire for civil services, IAS, IFS, and all that. So we had a student in Kota, Rajasthan, and he was under tremendous pressure to clear the UPSC examinations, because UPSC examinations as a last age. You cannot, after I think 29 or whatever, you cannot clear the exams. You cannot appear for the exams. So he had a pressure. He had to finish it, and so he studied late into the night. But when you will study late at night, naturally you will feel sleepy. And what do? You drink coffee. So you take excessive coffee. Luckily, he was not a smoker and all. Some people think that smoking will help you to work for longer hours. It's not correct. It will spoil the health. So better, even coffee, a cup is perhaps okay, but not taking too many cups of coffee or tea is not good. And then naturally your sleep also, because he's studying, so sleeping is very poor. So slowly what will happen? All these things, he started finding that he's having frequent palpitations. We have got good treatment for palpitations also. Okay, then irritability, then insomnia. Then he was fortunately that he was diagnosed only with type 1, stage 1 hypertension, but it was not because of diet or physical health, but due to chronic psychological stress. So he was quite healthy otherwise, but because of his stress levels, he was having all these problems. So slowly he was advised to take up neurotherapy, and then we advised meditation. Then he was advised to take regular breaks at night. And I used to tell him that whatever you do in the Brahma Muhurta, that will be very productive. So suppose you have to study from 12 o'clock till 2 o'clock. I will say those 2 hours, you study only 1 hour in the Brahma Muhurta time, you will retain much better. So I used to tell him that by 10:30 you go to sleep. And then, of course, because the therapy was working well, he was quite happy. And then he started doing that. And then he cleared the UPSC exams and all that. And he used to thank me also for it. So Now, exam stress, and this I am talking of one case, it is like this, so many youngsters, teenagers, students, college students, school students, they all do this. So they all suffer. They all do the same thing which this fellow is doing, was doing. So like that, we should all take this up as a this thing, as a service to the nation. Our youngsters are the future citizens of India. So all of us who are older people, we have to tell them. That is why I'm giving you real lifetime incidents, so that you can easily correlate it with and tell it to your youngsters, to the youngsters around you. Then, of course, alcohol and tobacco use. This is a well-known fact that this will raise the BP. Alcohol always raises the BP because it also increases sympathetic nervous system activity, and then it also leads to weight gain and liver issues, and these are all directly affecting the BP. Whether it is alcohol or tobacco, nicotine, it causes narrowing of the blood vessels immediately. So that is also this thing. So by that, the arterial walls get damaged, and then they become stiff over time, etc. Now, some time ago, I had a call from a 50-year-old hotel manager in Goa. So he had been drinking regularly since his college days, and in hotels and all, you have parties and everything, and the drinks are very frequent. And also smoked. He also smoked. So this was this thing, his habit. Then over the years, he developed, first because of the smoking, he developed breathlessness and fatigue. And suddenly one day he was having chest pain and hospitalized and all that. And there he was diagnosed. Normally, he thought that he was having, because sometimes he used to get breathlessness, he thought it was something like asthma because of his smoking, but he could only give it up. But then he was diagnosed with severe hypertension and early signs of heart disease. So that breathlessness is not only due to asthma, it is also possible due to heart disease. And I will give you a simple tip. Suppose while walking you feel breathless, then you can understand that it's got something to do with heart. Chalte chalte saans phoolna, we call in Hindi. Walking, while you are walking fast, you feel breathless. So that is not good, and that is not related to directly related to smoking. That means it is not because of your lung capacity, but it is because of your heart. Okay, so breathlessness while doing exercise is an indication. In usual cases, there may be, of course, the exceptions where a lot of things may be mixed up. That's a different thing. So then, because in his case, alcohol and tobacco had both caused lasting damage to his blood vessels and then heart function. So he was advised to quit all these things. And luckily, because he wanted to live well, so he said, okay. He said, what to do, sir? I get free drinks. We told him, don't do it. This free things is not good for you. You leave it. You have a family and you have to support them. So please be careful. So that means lifestyle addictions, which are prevalent in many Indian regions, they can lead to chronic illnesses like hypertension. Okay. Then diabetes and kidney disease, they also can indirectly impact blood pressure regulation. Why? Because diabetes damages the blood vessels, it reduces the ability of the blood vessels to relax. And kidney disease impairs the body's ability to eliminate excess salt and water. So both of that is increasing the blood volume. One is changing the blood vessel, damaging the blood vessel, and another is increasing the blood volume. So this is all what is called as metabolic syndrome. Okay. Then we had a case of a retired school teacher from Ahmedabad. She had been managing type 2 diabetes for over a decade. Of course, she was not able to regularly take neurotherapy treatment because Ahmedabad is a big city and we don't have so many therapists there. So they are all spread out. So she couldn't take it so much. But some treatments she was taking and she was okay. Her diabetes was more or less under control. Then, because she had sedentary this thing, she was a school teacher, no, she had sedentary habits. Unfortunately, she was developed, I mean, diagnosed with early stage chronic kidney disease. So this is normally a complication of diabetes, and she had diabetes for over a decade, more than 10, 12 years. So then, along with that, when they made a checkup, they found that her blood pressure also was 150 to 150 by 100. So now she was having diabetes, hypertension, and that chronic kidney disease. Kidney disease was, of course, in the first stage. So then, that is, they said, the nephrologist told her that because of your kidneys' reduced ability to eliminate sodium, so and the fluid had increased, that had increased your blood volume, that is blood pressure. So it is all because of the kidney. And for kidney also, we have got good treatments for such cases, where you have got early stage kidney disease. It's called CKD, chronic kidney disease. So we have got treatments for that, very simple treatments which the patient's relatives can do, the patient can do herself also. So then slowly she started improving within another 6 to 8 months. And that was all because she took active care. She followed diet restrictions, everything like that. So these are all some of the important factors which you have discussed. Now let us see what are the symptoms and signs. Now, hypertension, it is often called as silent killer. Why? Because for a long time there may be no symptoms at all till severe complications arise. But what are the common symptoms? And these are all not always related to, I mean, nobody will even think that they are related to hypertension. For example, headaches, dizziness, then your vision issues, and nosebleed, fatigue, and confusion. These are some of the important things. We will see why each of them is happening. That also I will show. Because now, headache, dizziness, these are all headache and all we may have from childhood, or we may have now and then. We will attribute it to, I mean, this thing, some problem in digestion, etc. We will not think it is due to hypertension. And then dizziness also, we may thought maybe I did not sleep properly, so I'm feeling dizzy. And this dizziness will not be there every day. It may be in the initial stages, maybe once in 6 months, 8 months, etc. Then nosebleeds are because of this thing, nerve weakness also. So it's invariably people who are having vitamin B12 deficiency, they can have this. Okay. Now, then another this is about hypertension. Now, hypotension, what are the symptoms? That can be dizziness, fainting, cold skin feeling clammy, then blurred vision. So dizziness, in the vision issue there is also possible in here also. In hypertension and hypotension, you can have blurred vision. Then nausea is very common with hypotension. So for all this, you have to have proper, treatment. For example, hypertension often is related to chronic headaches. And homemaker in Calcutta, she was complaining chronic headaches, and then we found out she was diagnosed with hypertension. So instead of treating her headache, we started giving her treatment for her stomach and for the hypertension. Immediately she started improving in her headache. So I mean, she did not get chronic headaches so often. Slowly the headaches went away, and the blood pressure also started coming down. Then, due to undiagnosed hypotension, sometimes a person can faint even. For example, we had the patient from Chennai. She was a teacher, school teacher. One day, she just fainted in the school because she was having hypotension. And similarly, if anybody is having a stroke, then that will be preceded by dizziness. So if you go immediately when you are feeling dizzy, if suppose you go to the doctor and then doctor diagnoses you and treats you for this thing, hypertension, then it is all right. Otherwise, you are likely to have stroke if you don't treat it. Then similarly, senior person in Lucknow, they get confusion due to hypotension, because enough blood is not going to the brain. Then you will feel confused. You are not able to concentrate properly, etc. Similarly, then sometimes farmers, they can collapse due to during field work because of hypertensive crisis. That's all hypertension. So now let us see how these symptoms, what they are, why they are linked with hypertension or hypotension. Okay. So headache, let us say, very common. Headache is very common for the distinct symptom of hypertension. So why it happens is because increased blood pressure, it can cause the arteries in the brain to become dilated or compressed. Both. Either they can dilate or compress. So why this is happening is because this activates pain receptors in the vascular system. Then it is linked to, in severe sudden cases, then high BP increases the intracranial pressure here, the pressure over here, and that is what leads to pulsating headaches. Okay. So sometimes what will happen, the body may become desensitized to these changes. So after some time, the headaches may fade, but the BP may remain high. So just because the headaches faded away, you cannot say, I am not having headache now, so I don't have to take BP tablet. No, you have to continue it till your BP becomes normal or till the doctor says you can leave it, which of course it's not likely. Okay. Because the doctor is very much worried that you should not have developed further complications. So naturally, you have to take the tablet. Okay. Then where does it hypertension affect most? One of the places it affects is the inner ear and the brain. The inner ear and the brain. So that is responsible for balance. And so you feel dizziness. That vertigo due to hypertension happens because of this thing. And for any problem with the inner ear, this I am telling now itself because I have taken this class earlier. 8 medulla is a very good treatment. For inner ear problems, 8 medulla. So we'll just see in short how this is given. Very simple. So you all know, I think you have those of you who attended my earlier class, it's all right for them, it is repetition. For newcomers, you can enjoy this. I'll show you how 8 medulla, very simple treatment. For any problem of the ear, this is the first starting treatment. Of course, there may be many more. So how do you do it? So this we start on the left side. First the left side, then we go to the right side. And I normally use 2 fingers. You must do 8 pairs. If you use 2 fingers, you will say 1, 1, 2, 2, 3, 3, like that, 8, 8, 8. But if you want, suppose I cannot use 2 fingers, sir, show me an easier method. Then I'll show you with 1 finger also. I'll show both. On this side, I will do with 2 fingers. On this side, I will do with 1 finger. You can do anyway, but 2 fingers is better because it is faster. Okay. So now let us see how do we do it. So we start from here, and then I keep 1 finger like this, and I now watch me carefully. I'll do it a bit slow, but you should do it faster than that. So I will do it slow. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8. And then hold here for a few seconds. Hold here. And where do you give the treatment? From here, there is a bone. Your skull actually is there. And then below the ear, there is a bone. From there, straightly down. That's all. This was 8 medulla on the left side. Now I will do on the right side. On the right side, we can do either like this or we can do like this. I will show with this easy. So what we are going to do, we are keeping this thing and we are giving treatment by this portion, just keeping it folded. Understand? Keeping it folded like that. Just like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Now, you don't have to tell loudly all these things, but you can just be, okay, you can just be, tell it to yourself. So I did 8 pairs here, and here I did 16 single, both are the same. This was 8 medulla. Normally, 8 medulla done once, wait for 1 minute, again do 8 medulla, again same way, wait for 1 minute, again do once more. So normally a pack of three, let us say a set of three. This is 8 medulla for what? For ear problems, for all problems related to the ears. And of course, there are so many other uses of 8 medulla. It has come there in other classes. So 8 medulla has got many uses. As and when it comes, I will let you know. Okay. Okay, now wait a minute. Where were we? Okay. Then blurred vision or visual disturbances. Now, this medulla treatment, your discounting is very important because different medullas work in different places. It is like, I have, let us say, mirchi powder, so this pepper curry powder, let us say. In some place in dal I may use 1 spoon, in something else I may use rasam, I may use half spoon, whatever. In raita I may use a little bit more or less. So like that, no, same item, it is used in different ways. That means it does different functions. Similarly, now for eye problems, eye dizziness, no, for eye dizziness alone, this treatment alone will not work. You have to treat first high blood pressure, because high blood pressure is the root cause. But for eye dizziness, the same medulla, I'm just giving you. In dizziness, there are two things. One is you may have double vision, or you may have just, lack of focus. Okay. So if it is double vision, then you should do what is known as three medulla. If it is just lack of focusing, you do two medulla. Then it will normally it will set right. And again, two medulla also into three with gap of 1 minute each. So how do you do two medulla? Very simple. Two medulla means what? If I do with one hand, it will be four. Okay. So very fast, we can do 1, 2, 3, 4. That's all. So simple. And this we can do easily with one finger. 1, 2, 3, 4. This is two medulla. Can do it, repeat it 2, 3 times. So it's very good. People who are having problem with vision, uh, even with specs, sometimes you don't feel comfortable. At that time, this two medulla helps. Okay. With specs also, you don't feel comfortable, two medulla helps. Like that. Okay, then. Then nose bleeds. This called, technical name is epistaxis. Epistaxis, nosebleed. Okay. And that is basically due to what they, in simple parlance, we call it body heat. It's not only due to body heat, it is due to vitamin B12 deficiency. Because vitamin B12 is the main, let us say, contributor for nerve health. Okay. Nerve means nerve, veins, etc. Okay, all those things. Nadi. So for that, we have got long treatment. I will not take that now. That's not directly related to blood pressure, but I'm telling you, if blood pressure is taken care of, then nosebleeds will taken care of. But I will give you a small tip, which because nosebleed is very common for children. They may not have hypertension. Even for them, it is, and if they are having BP problem, or if their body heat is too much, they can have, children can have this nose bleeding. And that it can be set right very easily. What you should do, one thing is, if you have nosebleed, then you should lie flat. You should make the child lie flat, with head slightly raised than the leg, because we don't want blood flowing up to the head. So head is raised, and then like that, the body is there. Okay, lie flat, and then should tell the child, close your nose, like that. Simple. Close your nose and breathe through the mouth. That's all. For at least between 45 seconds to 1 minute. If the child does it, children, what happens? They will just do it, and then they will get up and see, are they getting bleeding or not? That should be avoided. That temptation should be avoided. So the parent has to sit by the side, take a watch, and say, wait a minute, for 1 minute, don't get up. Normally 1 minute should be enough. Okay. Along with that, what they should do, the left hip, the left hip. So this is the left hip. Okay. Now just over here and over here. There are, in neurotherapy, we have got certain points. So all that you have to do is just hit like that, slightly hit, 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 hit like that. It may pain a little bit. It's about, we normally do eight hittings, like 1, 2, 3, 4, 5, 6, 7, 8. Normally we do 8 or 16. Only on the left side, not on the right side. Vitamin B12, according to neurotherapy, it is processed only in this region. Okay. Okay. So this is one. So along with that, you can do this. And then also, any bleeding, our body has got a natural antiseptic that is called thyroid gland. Okay, sorry, the antiseptic is iodine, and iodine is released from the thyroid gland. Okay, iodine, tincture of iodine was earlier a very standard, simple. Now only betadine has come. Before that, we used to have what is known as tincture of iodine. So this tincture of iodine for any cuts, any blood flowing out, it used to be the standard treatment, and it was working very effectively. No doubt. Just it'll burn a little bit because it contains, tincture means it contains alcohol, and that alcohol burns. Okay, but otherwise it's very good for this thing. So like that, this tincture of iodine, like that, instead of iodine there, you just have got you have got a thyroid gland over here. This is the Adam's apple. Just behind the Adam's apple is the thyroid gland. So all that you have to do is keep your finger like that and just give 2 gentle jabs. 1, 2. That's all. Like that, you may repeat 2, 3 times. Bleeding will stop also because of that. So let the child lie flat, then do like that, and then pat this area. Should be enough. Okay. So this is very simple home remedy for such problem. Nose bleeding. Okay. But if such nose bleeding happens in adults, and if it happens frequently, then they should check their BP, because that means the blood pressure is going high. So somewhere the veins are breaking. Okay, because of the pressure. Then high blood pressure may have one alarming symptom that is called chest pain, especially on the left side. Okay, this is the left chest. Okay, so 1 minute. So this is the left chest. Fine. So chest pain, for that we have got what is known as angina treatment. I have shared this treatment several times, 2, 3 times at least. I hope it will be there in the group. So in case anybody is having chest pain with high blood pressure, and the doctors say probably there may be some heart involvement, this angina treatment can be taken whether you are taking tablets or not. You can take this treatment. Very simple, very nice treatment. So, but it's a pretty long treatment. So I will just talk. One of those treatments is directly related to blood pressure. We'll teach you that. Okay, after some time I will come to the treatment set. Then we'll do all that, because it's a longer treatment. So I let it go as part of the set. Okay. So this, due to hypertension, what happens? The left ventricle has to work harder. The left ventricle is what? The left ventricle is the one which is pumping blood into the aorta, and from there it is going to all parts of the body. All parts of the body. So it has to work hard. And that is why when blood pressure is higher, then you have chest pain. And because this increased workload causes reduced heart supply, oxygen supply to the heart muscles, because the heart has to pump more, no? Then it can have a reduced oxygen supply to the heart muscles, and this can cause ischemic pain. Okay. So this also, if it can be due to what is known as coronary artery disease, then the doctor should be consulted. But whether, even though you will be consulting the doctor and you will be taking the treatment, it is best if you can add neurotherapy treatment for angina. That is called angina treatment. If you add it, it will be very useful. Okay. Then fatigue or confusion, I have already spoken about it, that when blood supply to the brain is reduced, then automatically it causes fatigue or the confusion. Okay. Then you have got what is known as palpitations. Now here, this is something where we have got immediate treatment. So I am going to teach this treatment. It is palpitations or irregular heartbeat. Palpitations or irregular heartbeat may sometimes accompany high blood pressure, hypertension. So at least this palpitation we can reduce. How? Same, I have already taught you medulla. Medulla only we have to do. But which medulla? Not what we have done up till now. Not 8 medulla and all that, 2 medulla, 8 medulla. No. We have got a treatment called 10 right medulla. Okay. 10 right medulla. So this is my right hand, and 10 right medulla is right side, same way. And this is also we are giving 3 times with 1 minute gap each. So I'll do once. Okay. And 10 we can do, this 10 is we can do either with 1 finger or with 2 fingers. Sorry. So 10 right medulla. How do we do? So I will do it with 2 fingers. It's easier, faster. Okay, now 1, 2, 4, 5, 6, 7, 8, 9, 10. That's all. So when I did one, I did with 2 fingers like that. Okay. So that is 10 right medulla. Only on the right side. Do it 3 times. Palpitations, like that. Suddenly you have a palpitation. You can immediately reduce it. After that, of course, go to the doctor. No doubt. Okay. Then shortness of breath. I told you just now that when you are having a cardiac problem, the heart, when it cannot pump enough fast, enough blood to the artery, to the aorta, then it becomes, you start getting shortness of breath, and this is all due to high blood pressure. Then sometimes it can also cause fluid to back up into the lungs. That is called pulmonary congestion. But that is a bit advanced stage. Sometimes pulmonary, if you have fluid in the lungs, it has to be taken out by what is known as tapping. But otherwise, for simple shortness of breath, especially due to walking, etc., running, you are running, if you have, it is less serious. Walking itself, if you have, then it's a bit more serious. And for that, same angina treatment is the best. Okay. Then it's sometimes nausea or vomiting. For nausea or vomiting, we have got 2 treatments. To stop vomiting immediately, we have got 15 medulla, and that will be done on both sides. Only 10 medulla for the right side. 15 medulla will be on both sides. Okay, so that is for nausea. Then we have got another treatment which I have shown earlier also, that is called CNNS gas. Okay, so I will show it. I'll show it here. Okay, this is my left leg. Okay, I will do it 1 leg at a time or both legs at a time. Both also can be done. I will first show 1 leg at a time, then I will show both legs also. Both legs, how we can do ourselves, it's very easy. Now what you have to do, you have to keep this portion of the finger. Okay, then you see this big toe. Now you can see it starts from here. And in fact, if you do like that, then you can see one small nerve sort of a thing starts coming. Actually, that is the Vajra Nadi. Okay, so And that is why it's called Vajrasan. When you are sitting, you are pressing this Vajranadi. That is why it is called Vajrasan. Okay, Vajrasan means you really feel like a Vajra, the real hardness comes in the body, in the backbone actually. It helps you to sit straight. So what we'll do, we'll take this. Okay, now you see, watch carefully. Very simple. Like this I do, like this I do, and then I bend it downwards where however comfortable, and hold there for 6 seconds. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Again, like this I do. Again, hold it for 6 seconds. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Then third one. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. So 3 times I did here. We can repeat it also, but to start with, we start with 3 times. Okay. Then we go to this was the left leg. Now we go to the right leg. Same thing. We can do. Okay. Like that. Same way. Hold down. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Similarly. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Third time. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. So 3 times I have done. And suppose you want to do it together, very simple. Okay. Yeah, sorry. So when you want to do it together, very simple. Just do from here. Start from here. Both sides. I am keeping it like this. Actually, we can do it like this. Okay. But I'll do it so that you can see me well. So here you can either use this finger or you can use this finger. I feel comfortable with this finger. So I will do like that. Huh? Okay. So I stood like that. Like that I do, and then I go down. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Second time. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Third time. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. So 3 times like this also you can do, or you can do individually. Very good. What does it do? It will increase the blood circulation to the stomach, and then it will prevent nausea or vomiting. So first we do, in case the person is vomiting, first we will give 15 medulla on both sides, 15 medulla and 3. Then after that, do this. If the person is not able to do it himself or herself, then somebody else can do it. Very simple. So this is very good. Okay. Then some people, they may get ringing in the ears. That is called tinnitus. Ringing in the ears is called tinnitus. Now this also can cause dizziness. And since it is also linked to the ear, so because you will sound in the ear only, and this is, for this also, the best treatment is 8 medulla into 3. So now we'll just give a short summary. Headaches, that is due to intracranial pressure getting increased. Dizziness or vertigo, that is due to impaired blood flow to the brain. Then blurred vision, that is due to retinal vessel damage. And for that we have told you 2 medulla. And if it is double vision, then 3 medulla. Then nosebleeds, I have told you due to B12. Then we have told you what are the things we can do, simple remedies, okay, thyroid, etc. And that is due to capillary rupture. And chest pain means heart overworking. Fatigue or confusion is due to poor brain muscle active this thing. And then palpitations is due to cardiac and electrical stress. And shortness of breath, that is due to heart failure. And heart failure means not immediately heart, but heart problem, let us say. The nausea or vomiting is due to improper blood supply to the stomach, and that is also can be because of intracranial pressure. and tinnitus means this thing in the ears, there is improper flow. Okay. So now, how do you diagnose this? What are the diagnostic tests? Diagnostic tests are, okay, we still have at least about 20 minutes. So I think I will, because this is another long topic, I will now go to the treatments, because we have got the diagnostic tests. They will teach you what are the diagnostic tests, then how you can do it at home, and all that. What are the pros and cons of the different types of diagnostic tests? This is quite an involved this thing, and when we should decide what test is to be done. So this I will cover in my next class. Okay. Now we will go to something to do with treatments, because I promised you I will teach you the treatments, and also we'll have to go to the diet. So before the diet, let us just have, there is one diet called DASH diet, dash diet. Dash diet means what? Dietary approach to stop hypertension. This is specifically for hypertension. What should be the dietary approach? So with that, after that we'll go to this thing, the neurotherapy treatments. Okay. So first thing about the diet is it must be rich in fruits, vegetables, whole grains, and low-fat dairy. In fact, dairy can be avoided for many reasons, because nowadays a lot of dairy products are only so many artificial chemicals are added. But in case you need some dairy, this thing, then especially vegetarians, they may require. For them, fruits, vegetables, whole grains, and of course millets. Millets have to be taken. And they should have the diet low in saturated fats, cholesterol, and sodium. This, by doing this itself, it can reduce systolic BP by between 8 to 15 mg, 15 millimeter. Okay. And then in India, you have got papaya, guava, so many mango, so many fruits are there. And then totally avoid fried foods and use mustard oil or olive oil, etc. for cooking. They are very good. Then salt restriction should be first primary priority. Okay. And according to World Health Organization, they say less than 5 grams of salt a day. That means if you add half salt to your food and don't add any salt, otherwise, I think that should be more or less okay. Okay. And then reduce or avoid pickles, papads, salted snacks, etc. Okay. And if at all you have to use salt, it will be better to use rock salt. Okay. So this is it. Then of course avoid butter, vanaspati, and fried foods. Ghee can be taken in small quantities with hot chapati or hot rice or whatever you are eating, millets. Okay. That you can take a little bit of ghee, but not fry the item in ghee. Okay. The hot item, a little bit of ghee may be added. That is because ghee is also having many medicinal properties. That is why. Okay. Then this thing, use groundnut oil. Sometimes some people have problems, some people don't. Groundnut oil is okay so long as it's not too much refined. In fact, avoid refined oils and take less refined oils. Then you should increase. See, because sodium and potassium, they always have an internal balance. Means when sodium becomes high, automatically potassium becomes low. And suppose I do something to increase potassium, sodium will become low. That means it will balance. So for anybody with hypertension, what we should do is we should increase the potassium level. And what are the food containing potassium? Bananas, spinach, that is palak, then sweet potatoes, and especially sweet potatoes with skin. If it is eaten, it can be eaten roasted, no, without any oil. You just roast it on flame and then add the lemon and add a little bit of salt or whatever and eat it. It's very good. Then coconut water is a good source of potassium. So all these things help to counterbalance the effect of sodium on BP. Hmm? Only kidney patients, they should avoid excess potassium. Okay, then this was the DASH diet. Simple, the things which I told you. Then you have got physical activity, minimum 30 to 45 minutes a day. You must do something, preferably walking, fast walking, brisk walking, cycling, yoga, etc. And now in this, I have, in one of my previous classes, I have told there is one thing called 3-step rhythmic breathing, TSRB. You can look it up. They have got very good exercise also. Okay, but it's very simple. 3-step rhythmic breathing means I should inhale longer and exhale faster. And this is in the ratio of 3:2. So, how do you do it? Just to give you an example, in, out, out. 1, 2, 3, 1, 2. So in 1, 2, 3, I will inhale. 1, 2, I will exhale. That means by exhaling, I am throwing out carbon dioxide faster than my oxygen intake. So that means oxygen I am taking slower, and I am throwing out the carbon dioxide faster. And that is very good. It is even good. Anybody, I heard one of the persons had told us in one of the Joshi's group classes only long ago that she did it. And I told them that this can be done for people who find difficulty in climbing staircase. So that lady did it, and she later on gave me a feedback that I did it, sir. I am finding very easy to climb the stairs. So what do? I told her, now just when you are keeping your step, 1, 2, 3, you are keeping. So right, in, then other 4 and 5, out, out. That means inhale in 3 steps, outhale in the 2 steps. I mean, exhale in the two steps. So inhale and exhale. So simple. 1, 2, 3, 1, 2, 1, 2, 3, 1, 2. This is all the rhythm. Very nice rhythm. And actually, I remember this long ago in Vivekananda Kendra. A group of scientists had come from Baba Atomic Research Center, and they told us this, that they had tested this, that it is very good for cardiac patients, and then they found so many benefits because of this 3-step rhythmic breathing. 1, 2, 3, 1, 2, 1, 2, 3, 1, 2, like that. And you can use it for fast running, you can use it for slow walking, any way you can use it. Very nice. So this also you should all try. You can all try. Very simple physical activity. And of course, figure of 8 walking in the room. Suppose you are unable to, suppose there are rains, you cannot go out, then walk in the house, fast figure of 8, like that. Figure of 8, reverse walking, etc. Staircase climbing, all these things can be done. Okay. So by all this, after that, we will now come to our neurotherapy treatments. So before that, you should understand how neurotherapy is approaching this hypertension. So we do a few things. I will go in short. I will cover it in detail next class, because now I want to go to the treatment. Enhance blood and lymphatic circulation. This is what we do. We enhance blood and lymphatic circulation. Then we improve organ function, especially the kidneys, liver, and adrenal glands, etc. So now, what is the treatment? Now we come to the treatment. All of you, please pay attention. Those of you who are having BP, they can do it with me if you like. Okay. First treatment is 30 medulla. What does it do? We have got a chemical called prostaglandins in the body. It is made in almost 13 locations in the body, 13 locations, different locations. And it's a local hormone. Means it will work within a small range. Normally, hormones, they work through the blood, and they work for sometimes for days also. Okay, but this is a short duration acting hormone, 30 medulla. And for this, it will be nice if you can do it on your own, or you can ask somebody to help you to do it. So when somebody else does it, it will be nice if they keep if your this thing like this. I'm just showing, like, actually it has to come like this. Okay, you have to keep like this. You have to cup the neck, and then you have to do like that. Very simple. Okay, like that. It's very easy to do it that way. Suppose you don't have anybody. You want to do it. You want, sir, please help me. I must do it myself. Very easy. As I told you, for this, because it is 30, to do with a single finger, you have to count 60. You may make mistake also in counting. So in this, you should practice how to do it one finger after the other. Now I have to start on the left side. Okay, as usual, left side. So I will show you how you can do. It will be a bit fast, because that I want you to, by seeing this, this thing, you can practice on your own also. Okay, you can practice and do it on your own. Fine. So I'll teach you very simple. 30 medulla. That's what we are going to do. 30 medulla for systolic high blood pressure. 150, 160. All those people, they will see immediately it will come down. If they do, we normally do one round. You can do up to 2 rounds with a gap of say 5-10 minutes. Suppose you are having high BP, you can do it. Okay. So how do you do it? Very simple. So let us see. So start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. Just for a few seconds you hold. So this was 30 medulla on the left. Now we will do 30 medulla on the right, same way. Very simple. Okay. 1, 2, 3, 4, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. Okay. So this was 30 medulla. Normally, this will reduce the systolic BP easily. Wait, do this. Wait for about 2-3 minutes. If you have a BP meter, measuring at home, you can do it. You can take this thing test. You can take the reading. And then after that, we have got another 3 points, but they should be done together. After 30 medulla, we have to give a break. But after that, these 3 points, they should be done together. And I will first tell you where all we are going to give the treatment, and then we'll do it together fast. Anybody can do this also, because it also helps with digestion. Okay, and it also helps to reduce the systolic BP. Again, this also works for systolic BP, because that is our main problem. No, most of the people have systolic BP much high. Okay, then we will teach diastolic BP also. Okay, so what is this treatment? It is called COLE treatment, CHOLE, COLE or chole, whatever you want, you can say, CHOLE. Okay, 10 medulla, 6 gassei, 3 gall, we call it. Now, where are the treatment to be given? One is medulla over here. Okay, that I have shown you. I will show you 10 medulla also. Then gas I means it is for the intestines. So in neurotherapy, when we stimulate this area, the calf muscle region, it stimulates the intestines. In neurotherapy, when we stimulate the calf muscle region, it stimulates the intestines. And we have to do 6 rounds. And here we will have 3 places. Wait a minute, you don't start the treatment yet. Listen to me. In every place, I have to hold for 6 seconds. So it's a slightly long treatment. Then after that, immediately I have to go to my left thigh. This is my left thigh. Okay, left thigh, I will have to do in 3 locations, 3 rounds. So this entire package will immediately reduce the blood pressure, systolic blood pressure. It may slightly have and there is a better effect on the diastolic, but it will not reduce so much. Systolic will reduce. Diastolic will reduce by the next treatment after this. So first we did 30 medulla. Now we do 10 medulla, 6 gassai, 3 gall. Okay, 10 medulla, 6 gassai, 3 gall. 10 medulla here, 6 gassai over here, 6 rounds of 3 places each. So totally 18 places. Then 3 gall is 3 places, 3 rounds, 9 places. So 10 medulla, you can remember it, 18 places here and 9 places here together. Okay, let's start. Okay, I hope I am not too fast, but because it is now, we are almost 38. So I have got about 12 minutes left. And this, we want to do P heparin. So that's it. And in my next class, I will spend more time, because now I have given you the fundamental. In the next class, I'll spend more time taking question answers. And there also some theory will be given. Okay. Okay. So now 10 medulla, 6 gassai, 3 gall, to be done together, no break, except just for moving the legs, etc. That's all break. Okay. And if you have another, if you are a patient, then another person can also do this to you by seeing this. Very simple. Okay. Now let us do 10 medulla. Okay. Now again, 10 I will do with 2 fingers. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 9, 10. This was the left side. Now right side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So 10 medulla, 10 pairs here, 10 pairs here. Left first, right next. Okay. So that is 10 medulla. Then come to 6 gassai. I keep my palm like this. I press downwards. I start from here, first location, second location, third location. I will not press on the bone. I will press on the calf muscle. So just like that, let us start. Keep your legs flat like this. Now, if you people cannot bend like this, then it is a bit difficult. Then somebody else has to do it for you. Okay, now let us start. 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Then again I say 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Third location, 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Then second round, 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Middle portion, 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. End portion, 2, 1, 2, 2, 2, 3, 2, 5, 2, 6. Third location, 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. Middle one, 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. End position, 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. Fourth location, 4, 1, 4, 3, 4, 4, 4, 5, 4, 6. Sorry, fourth round. 4, 1, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6. Fourth round, last location, 4, 1, 4, 2, 4, 4, 4, 5, 4, 6. Fifth round, 5, 1, 5, 3, 5, 4, 5, 5, 5, 6. 5, 1, 5, 2, 5, 3, 5, 4, 5, 5, 5, 6. And 5, 1, 5, 2, 5, 3, 5, 4, 5, 5, 5, 6. Last time, 6, 1, 6, 2, 6, 4, 6, 5, 6, 6. Middle location, 6, 1, 2, 6, 3, 6, 4, 6, 5, 6, 6. And 6, 1, 6, 2, 6, 3, 6, 4, 6, 5, 6, 6. Then we come to left thigh. Left thigh, first I will keep both hands together and I have to press inwards like this. So I have to press like this, not go outwards. Okay, start. 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Middle, 1, 1, 1, 2, 3, 1, 4, 1, 5, 1, 6. Middle, end, 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Not on the bone, remember, only in the fleshy portion. 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Middle thigh, 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Kneecap, 2, 1, 2, 2, 2, 3, 2, 5, 2, 6. 3-1, 3-2, 3-3, 3-4, 3-5, 3-6. Middle 3-1, 3-2, 3-3, 3-5, 3-6. Last 3-1, 3-2, 3-3, 3-4, 3-5, 3-6. This entire package is called Chole or Chole treatment or Chole, Chole. Very simple, 10 medulla, then 6 gazi, that is 18 locations, then 9 locations, gall, 1, 2, 3, 4, 5, 6, 7, 8, 9. This together is called Chole treatment. So these two, first 30 medulla and this, they are for systolic BP. Now for diastolic BP, in my previous class also I have shown this. This is called P-heparin. P-heparin. That is for diastolic BP. And you just have to wait for about a minute or so. So I will just drink a little bit of water and then we will continue with the P-heparin. Okay. Fine. I hope somebody of you have been doing this with me. Of course, I was fast, but I can't help it because that has to be done like that. If it is not fast, then it won't produce that result. I mean, this is the minimum speed, not too fast. It was okay. Now, after this, as I said, we'll go for P-heparin. P-heparin also has got 3 different points. One is called 8-pan here on the groin. Then second is called 7-liver, 1, 2, 3, 4, 5, 6, 7. Then chest only, 12, 12, 12, 12. Okay, we'll start on the left side, 12, 12, 12, 12. I will show you how it is done. Only this liver, for newcomers, I am repeating. Pan, of course, I will show very easy. Pan means I have to keep press downwards into the groin. Now, liver, for newcomers, how we do is we have to apply simultaneous pressure, one over here and then one over here. So what I do like this, that I press with my hand like this, and then with the back of this thing, with this bone over here, that bone presses over here. So for first location like this, then second location here, third location here. And similarly on the thigh, first location here, second location here, third location here. That's all. So this will be 1, 2, 3, 4, 5, 6, and 7th will be in the middle. So this is 7-liver. So 8-pan, 7-liver, then 12, 12, 12, 12. That is called 8 chest only. This together is called P-heparin. So now we start. Some gap has been intentionally given. So now we start. Now let us see. I keep my hand like this and I press with this portion, not with this portion. I press with this portion like that and pull as usual. I pull slightly inwards. So, and you have to lean a little bit forward. Okay, because then only you can get the real weight over here. If you do like this, you cannot pressure. It will not give good pressure like that. So, okay, let's start. P-heparin. Everybody can do this P-heparin except people who are having some cut or wound. Except that person, anybody or people who are in there, having heavy flow in menses. If you are having light flow, you can do this. It will help you. If you are having heavy flow, then don't do it. Okay. Otherwise, everybody can do it because it increases circulation throughout the body. Okay, fine. Let's start. Now 8-pan, same location, 8 rounds, 6 seconds pressure. 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Lift and remove again. 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Lift again. 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. Lift. 4, 1, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6. Lift. 5, 1, 52, 53, 54, 55, 56. Lift. 61, 62, 63, 4, 65, 66. Lift. 71, 72, 73, 74, 75, 76. Lift. 81, 82, 83, 84, 85, 86. That's all. Then 7 lever. So as I said, I keep like this one. Then second place I will keep here. Third place I will keep here. And no stopping in between. Continue. Okay. Now start. So we can keep like this and pull inwards. 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Second location. 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Third location. 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. Fourth. 4, 1, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6. 5, 5, 1, 5, 2, 5, 3, 5, 4, 5, 5, 5, 6. Then 6, 1, 6, 2, 6, 3, 6, 4, 6, 5, 6, 6. Then middle position 7, 1, 7, 2, 7, 3, 7, 4, 7, 5, 7, 6. Then 12 times stroke 4 rounds. So like this, I keep my hand like this. And here also I am trying to give here, but of course it will be the whole place. Slowly keep your right hand like this. Okay. Sorry, we have to start from the left. We have to start from the left. Keep your left hand like this. Okay, my left hand, this is, we have to start from the left. So keep your left hand like this. With my right hand, I am stroking upwards. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Then this side, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So once again, left side, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Here, 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12. That's all. Take long breath 1 or 2 times, 1 or 2 rounds. Okay, so this was P heparin, 8 pan, 7 liver, then 8 chest only, 12, 12, 12, 12. Okay, so that is P heparin. Now with this, today's demonstration is over. We still have, no, we don't have much time. So anyway, now we will have some more treatments in the next class, okay, and more information. So I thank all of you who have stayed back. 80 people have stayed back for this session. So I'm really grateful to you for taking the time to stay back. And now Anusha madam can end the session, and then I will give my blessings. Thank you.
I request whoever have raised their hands to please go back to the group and write your questions there. Now it's already time up, so you have to go back to the group and write your questions. First, write your questions, those who have raised hands. Then others, you please go back to the group and share your vote of thanks. And now, before ending this session, we send gratitude to Sir for this wonderful session as always. And we wait for Sir's blessings to finish so that we can end this session with lots of gratitude to Divine and Sir. Thank you, Sir.
Okay. I take this opportunity to thank all of you, and may God shower his choicest blessings on all of you and your families and your friends and their families. May God bless us all with health, happiness, harmony, peace, prosperity, and success, health, happiness, harmony, peace, prosperity, and success. Thank you very much. Have a good day. Have a good night, rather. Good night sleep. Well rested. And then please give your questions in the group. I will try to answer them. Okay. Otherwise, you can ask next time also here. Okay. That also option is there. But write about this, whatever class you did, please write about it in the group. Thank you.
Gratitude, sir. Now I request all of you to please go back to the group and share your feedbacks. And first, remember, those whose questions are pending, you can ask it in the group itself, or in the next session, we will have a starting few minutes for you so that you can finish your queries, and then the new session will be starting, so that all the old queries will be over. But only mostly 5 questions will be taken for the next session. Otherwise, you, I think, will keep raising your hands till the end of the session, and the new session won't continue. So next time when you have questions, only 5 will be answered. The rest have to go back to the group. So now also you go back to the group and ask your queries with at Neurotherapy or at Ramachandran sir, so that he can understand for whom you are asking the question and for what you are asking the question. Okay. Because there are many trainers in the group, it is very important for you to be very specific to whom you are informing or asking or giving feedback. So I request you all very kindly and humbly to please go back to the group and share your feedbacks, questions, and everything. And please be clear on what this session held for today was, what was taught, etc., so that everyone will know what they are missing. Okay. So thank you so much. Happy weekend to all of you. And tomorrow 7:30 p.m. please attend the equipaper therapy session. Till next Friday again. And we'll be meeting sir for the next coming session. The topic will be informed in the group. So till then, have a happy weekend. I am just unmuting all of you for a quick vote of thanks. So just finish your vote of thanks, and I am ending the session after that. Thank you.
Thank you so much, sir.
Thank you, sir.
Thank you, sir.
Thank you.
Thank you,
Thank you
sir.
so much.